Welcome, everybody. I'm Dr. Andrea Barthwell, Chair of the Board of the Global Recovery Initiatives Foundation. We're so excited to have you be part of our first presentation of our latest initiative, the National Recovery Friendly Workplace Institute, its national certification. Many of you know that GRI has been working in the recovery space since the 1980s, first launching recovery schools and then young people in recovery. In recent years, we convened 2 recovery research summits, working closely with ONDCP, leadership at SAMHSA, NIDA, NIAAA, and CDC, as well as universities, research institutes, leaders in the recovery movement, and elected officials. Through that work, we defined a research portfolio that is being funded across the country into what recovery is. And we are excited now to move into our next initiative. Last September, during Recovery Month at the White House, we held an event that put a spotlight on recovery in the workplace. Governor Sununu led the way to states engaging employers in creating recovery-friendly workplaces, and the movement has been growing over the last 5 years. GRI's National Recovery-Friendly Workplace Institute responded to both the White House goal and the National Drug Control Strategy Recovery section to build a recovery-ready nation, and to its release of a fully researched recovery-ready workplace toolkit late last year. Many of you have been wise and helpful guides, not only to the creation of the Institute, but to the content of the certification. The November announcement of the toolkit and the creation of the Institute required GRI to seek funding, engage employers and businesses, association leaders, meet multiple states and stakeholders already working in the field, to collaborate with federal leadership on what was needed to happen, first, second, and third, to make progress quickly. Startup funds require the courage to ask and funders to have the courage to step into the unknown. And we have Chuck Campbell to thank for our startup funds. Chuck Campbell has worked in corporate America for much of his career, and he leads the McMillen Family Foundation. He stepped up not only offering seed funding, but guidance and introductions to major employers to support the Institute. Chuck walks the walk and talks the talk. He and his family set up the McMillen Family Foundation 18 years ago and have put out over $60 million in grant funds. It's set up to go on in perpetuity, and we're only a small part of the work that they do. But he's lived a life also in recovery for almost 40 years now. He's going to be celebrating that big non-belly button anniversary later this year. And in my eyes, though, he has a little over 3 hours of sobriety. My first sponsor taught us we don't count our years. We only count the amount of wake time we have on any given day. And we try to make that time count. So he got up at 6:15 this morning. He's had a little over 3 hours of sobriety, but he spent that time conducting an intervention with someone who is still suffering outside of these rooms across the country, help facilitate an intervention with that individual, and that person is getting on a plane now on the way to treatment and recovery. As a consultant to Fortune 1000 companies in the workplace area with HR and wellness, he believes that this is how change is going to happen, the very work that we're engaged in now, and it's going to start here. And you're going to hear a lot more about him in a moment, but I'm also going to introduce our major presenter of the certificate program today, Mike Barnes. Mike Barnes is a senior consultant to GRI and the Institute and the author of our inaugural National Recovery Friendly Workplace Certificate. I met Mike very soon after I joined ONDCP in 2002 and put him through a series of interviews so that he wouldn't know how clearly convinced we were that he was the person that we needed in the office to help us move our agenda forward. But we knew the moment we met him that he was going to be very special for us in ONDCP in helping to move the agenda forward and to the treatment, intervention, and recovery agenda. And Mike has helped me and many other people over the years to achieve their goals, because he understands, like no one but a Washington insider can understand, how policy gets done and how funding happens in Washington. So I'm going to turn it over now to Chuck Campbell, And Chuck is going to introduce Mike. But one more thing about Mike before I turn it over to Chuck. When we met Mike, we turned in our notice to the White House Office of Personnel Management that we wanted Mike to fill the position that we were interviewing for. He showed up a week later with his name on a parking space in our building, which is really a phenomenal thing to do in Washington, to get a parking space at a White House office building. So we knew then that we had selected the right person who had the content and the intellect and also the contacts in Washington to get the job done. Chuck, I'll give it over to you now.
Thank you, Dr. Barthwell, and for that glowing introduction. I'm not sure what else I can say about myself after all of that, but I really appreciate that. And thank you to everybody who's on this call today, because without all of you, none of this would happen. As Dr. Barthwell said, I started the foundation with my family about 18 years ago. We are private, so it's no outside funds, which gives us the ability to really focus on the important things to us, which started with help the people who can't help themselves. We do a lot of work with homeless people, homeless vets, individuals that just can't find a way to get into treatment. We take care of that, and we fund about 150 different recovery centers. Also, we've got a big focus on children and education and prevention, because we want to be able to try and stop this before it starts. But we've enjoyed what we do. It's my passion. It's my family's passion, and we'll continue to do so for a long time. A little over a year ago, I met Cathie, and it was actually through something GRI had done in the past, and I reached out to her because I wanted to know more about what they do and how we can help. And when we started talking about this recovery-friendly workplace, and she told me about what Governor Sununu had done, and it just really piqued my interest, and I thought this is something we could truly get behind. The fact that I spent the last couple of years in corporate America, in the healthcare side, and dealing with people in human resources and senior executives as well as wellness, I've got to hear from them as well what their desires would be, and how do we help people? How do we get people more incentivized to get the recovery that they need? And what can we do for them after the fact? So when Cathie and I were talking about this and understanding that what Governor Sununu had done, this was a no-brainer for us to work together and find a way to get this financed. And putting together the event we did last October in the White House was amazing. So now we get to work with all of you. And actually, all of you are the real people that are going to make this happen. You're the champions within your own workplaces. And that's what we need. Without you, without having the champions to actually drive these initiatives, it wouldn't go anywhere. But what I'm seeing right now is what I do, what my foundation was, what GRI does, now what all of you are looking to do is our priorities, our incentives are all aligned. And moving forward, I think this is something, it's a movement that we can get going and get behind. So I'm really proud to be a part of this. I'm looking forward to seeing where everything goes after today. And again, I'd like to thank each and every one of you for being a part of this. With that, Mike, you want to take over and tell everybody what we're doing?
Yes, absolutely. Dr. Barthwell, thank you for the very kind introduction. And I'm pleased to share with you a preview of what we're going to be discussing today. We'll talk about the consultative process that we followed in order to develop the certification standards for recovery-friendly workplaces. We'll talk about a new definition that came as a result of that process, and then get into some of the nitty-gritty around certification and the recommendations that ultimately we received and implemented related to the standards for making a difference and bringing the field forward. And then the Executive Director of GRI, Cathie Hartnett, will also explain some of the additional activities that the Institute is pursuing. If you have any questions, we would like to ask that you email those questions to info@rfwinst.org. And the reason that we're asking that you send those questions in is we want to be able to respond precisely. We'll do so in writing. And then we also want everyone to be able to benefit from those responses as well. And so we will send out the responses to the questions as well as our certification document and these slides to the participants after we've concluded this session. So again, if you have any questions, please email them to info@rfwinst.org. So this brings us to a brief discussion of the very first three priorities of the Institute as we got started, thanks to the McMillen Family Foundation's Jumpstart in December of 2023. We were able to accept the transfer of the community of practice from New Hampshire's Recovery Friendly Workplace office and the office of the governor. Thanks to the hard work that they put into developing the community of practice, we were able to begin staffing that. And Eliza, Zarka, and Cathie are really the primary leads on that. And that's an ongoing resource group that enables people who are working in this field to share their learnings and answer questions and overcome challenges. We've also been working really hard on a daily basis to advance state-based RFW initiatives, and we'll go into greater detail about the roles of the state entities in advancing recovery-friendly workplaces. But we're really honored to be working with the National Governors Association's Center for Best Practices Continuum of Care Policy Academy, with a couple of states to help them determine how best to advance recovery-friendly workplaces in their jurisdictions. And then our other priority has been what we've been working on nonstop for the past several months, to consult with stakeholders first and foremost to get input, and then incorporate that input into a definition of RFW that at least is close enough that we can have people get behind it, and we can be close enough to on the same page as it relates to definition. And then the criteria for national certification, with the hope that we will then see some uniformity come across other certifying entities, whether they be state or local entities. We are going to be discussing today the National Recovery Friendly Workplace Certification Program, and that will be for multi-state and multinational employers. So the document, as I mentioned, will be coming out. We'll be releasing that this week and likely today, right, Cathie? All right, and it's a lengthy 23-page document, but we go into great detail because we want for the readers of the document to understand that this has not been something that has been dictated. This has been something that really has been established by consultation with a number of individuals who've been working in this field longer than many of us. So we started with a literature review, looking at, as we heard Dr. Barthwell mention, the Federal Recovery Ready Workplace Resource Hub and the toolkit from the interagency working group in the federal government, including ONDCP and SAMHSA. The Recovery Friendly Workplace Multi-State Community of Practice Materials. Again, the Community of Practice is the one that was transferred to the Institute from New Hampshire, thanks to New Hampshire's leadership on all things RFW over the past several years. And then we looked at the RFW definitions. Our Director of State Engagement, Eliza Zarka, provided a list of definitions that she's been compiling over the past few years of her career. And that was tremendously valuable because we were able to draw from most of those, incorporate the best elements of those into our definition, which we then enhanced with the input of the stakeholders. So as it relates to certification itself, beyond recovery focus, we looked at various other types of certification programs, starting with, for example, certification of programs that federal government suppliers go through. So looking at those, we recognized that was not a real fit because that went to who owns the companies and how that ownership is made up. And we ultimately landed on the types of certification programs that we see for LGBT equality, for disability equality and inclusion, and then workplace mental health. And so we looked at the HRC Foundation's Corporate Equality Index, Disability In's Disability Equality Index, and then Mental Health America's Bell Seal for workplace mental health, among others, of course. But those were certain models that we wanted to make sure that we looked at as we set up this certification program for RFW. So we came up with a draft, and then we sent a questionnaire and conducted interviews with members of our certification working group. And I'll tell you more about them shortly. Then after we incorporated their feedback, we sent out another draft, got an additional round of feedback from the certification working group, and then ultimately incorporated that into the final document, got bits and pieces here as we read over the input and got additional emails from people, conducted additional interviews, and ultimately, I think yesterday at around, 4 p.m., Cathie and I said, okay, we've got a good enough version to send out, but this has been months in the making. And we want to make clear also that we're proud of the document that we've developed with many of you who are also here in the webinar today, but we also recognize that it's not perfect. It's our first stab at it. And so we have proposed a method for there to be edits and additions, and that is clear in the document as well, because we know that as the field progresses, we'll want to raise the bar. We want to increase the certification standards as everyone makes progress. And in the meantime, we'll also have an opportunity to provide feedback on this document itself and the standards substantively throughout the year. So our 22 certification working group members represented the GRI Board of Directors, which Dr. Barthwell leads. We also had representation from the McMillen Family Foundation, but then we got input from representatives of Wire Health, Hypertherm Associates, Equifax, SAMHSA, and ONDCP, New Hampshire's Governor's Recovery Friendly Workplace, Sober Curious at Cisco, Recovery Friendly Hamilton County, part of Hamilton County, Ohio's Public Health, the International Center for Addiction and Recovery Education, iCare, Sober Incorporated, Oracle Corporation. We had a member of United Auto Workers who chimed in. We heard from Colorado School of Public Health, Shaw Industries Group, as well as Appalachian Regional Commission. So each of these entities put the time and effort into reviewing the various documents that we sent them, participated in interviews, and enabled us to come up with this version. I want to make clear, though, that none of the entities that were part of the certification working group has endorsed the document. We haven't created a document that has any sort of endorsements. This is the content of GRI as set forth by its independent board of directors. They exercise their exclusive discretion in determining what the contents of the certification document are. And so we want to make it very clear that the GRI and the Recovery Friendly Workplace Institute are independent entirely. So the definition that we came up with, based on the study of the definitions that Eliza's compiled over her career, and then the input that we received from other experts in RFW, is on this slide. It's a recovery-friendly workplace is a place of work in which the employer, in collaboration with employees, establishes, maintains, and continually enhances policies, practices, and a culture and work environment that are supportive of current and prospective employees in recovery from or otherwise affected by substance use disorders. And we want to make clear here that in collaboration with employees really is meant to express that employees are the ones who make this happen. This is not a top-down model. This is not a dictate that's going to come from a CEO or an HR director. What I love about this definition, and I'm not giving credit to anyone besides the people who've created definitions before this that we drew from, is that it really is one of the most inclusive definitions that I've seen over the course of my career in prevention, interventions, treatment, recovery support, where we're talking about people who are in SUD recovery. But the definition also includes people who have current active SUDs or at risk of SUDs, and then those people who also have loved ones who are in recovery, have SUD or at risk of SUD. And so who among us is not included in this definition? And that's really the point of all that we're doing. We want to bring as many people into the fold and have as many people support the work that we're doing to advance recovery in the workplace and beyond. And hopefully with that definition that is as inclusive as what we've come up with. So stepping back, most of you know this by the lives that you live and by the work that you do. The reasons for designating and certifying a workplace as recovery friendly is really to signal to the market, right? But there's also that you're, a responsible employer and that you are occupying that place of inclusiveness. But there are some benefits that go to the business bottom line as well, going to increase productivity, better employee health and satisfaction and morale and loyalty among the employees. Much better communication, which we'll see as a part of our certification standards, the connection with the community, a greater part of the community, including people in recovery, and of course, customer loyalty. And as a result of the efforts to advance recovery-friendly practices, workplaces see reduced absenteeism and presenteeism, where people are showing up and just not getting as much done as they should, fewer workplace injuries and incidents, lower expenses for healthcare, disability, and workers' comp, and then lower turnover and related costs, and then less harm to employees, families, and communities. So that's the basis of the employer's business case, the business perspective for becoming an RFW, but there's so much more. Moving on to the role of the states, because we have discussed the importance of state organizations. We see that state organizations will be able to advance recovery-friendly workplaces in a number of ways, starting with awareness, including engaging employers. That's one of the most important things that we would envision for state entities that are advancing RFW. There are many states that currently have those entities, and there are many that do not. Eliza will tell you more about our numbers, but also state entities advancing RFW should be informing employees, as well as they have a role in policymaking and educating and creating awareness in the public. Providing education like professional education as well as technical support for employees is another important thing that we know that state RFW entities are now doing, those services that they're providing. And then workplace certification may or may not be a component of a state level program, but we know that absolutely employee engagement will be. And the Institute intends to collaborate closely with these state entities that are advancing recovery-friendly workplaces to make sure that we are complementary and supportive, not duplicating efforts, not wasting resources, and all rising together. So Eliza, I would like for you to share some of your color commentary on state engagement, please.
Absolutely. Thanks, Mike. Good morning, West Coasters. Good afternoon, East Coasters. Hello to everyone in between. I'm really excited to say that we have representation from nearly every state registered to attend this webinar, and even a few from Canada. And as the Director of State Engagement, in these first not even 5 months of existence of the Institute, I've had the opportunity to meet personally with 28 states and counting to discuss expansion and establishment of state programs in everyone's states so that national certification and state programs can complement each other and build awareness and momentum for this national, and I'm looking at you, Canada, now international movement. We are seeking additional funding for a map that would be clickable so that as we are aware of state programs that are servicing businesses in their states for designation, that people would be able to see what those programs are. So that is an asset down the line, but just wanted to chime in to say, thank you all for being here, and we really look forward to seeing how national and state level certifications can match up with each other. Thank
you, Eliza. All right, so this brings us to the most important discussion of the day, what everybody's curious about, the 2024 National Recovery Friendly Workplace Certification. As I mentioned, this is going to be for multi-state or multinational employers. So if an employer has somebody even working from home in a different state and they pay taxes and workers' comp insurance in another state, that would count in this first year at the very least. But if there's someone who, has a couple of gas stations in a community and is in one single state, we would see that would likely be a better fit for a state program. If there's not a state program, the National Institute is eager to help as many parties as possible, and will not say no to anyone so long as we're continuing to collaborate and not step on the toes of the state organizations. And so the point is to bring in as many employers as would like to be certified recovery-friendly workplaces. And we also acknowledge that as we talk about employers, the employers oftentimes will have multiple workplaces that will span different states, and each workplace will also have its own unique culture, reflective of where it's located and what the employees do. So we don't want that to go unnoticed as we're having this discussion. The certification criteria are categorized under 4 headings: the workplace culture, hiring, retention, and advancement, benefits, like employee benefits, like insurance and other sorts of time off, and education and awareness. And so under each of those categories, there are criteria that each have 5 to 10 points. And in order for an organization to become certified in 2024, it'll be necessary for the applicant to earn points under each of the 4 categories: culture, hiring, benefits, and education. And then score 40 points or more in total across those 4 categories. So here's an example. If we see that a company applies and has an RFW statement, like was recommended in the ONDCP document, and like we've heard about and read about in Hamilton County's RFW resources, the statement will include required affirmations that we'll put into the we have put into the certification document, and then also checks the box for substance-free options at work events, meaning that during work functions, if alcohol is present, the employer provides and also publicizes that non-alcoholic beverages are also available. So the mocktail movement. So if they got 2 checks there, that gives them 10 points, and that's under culture. So they got 1 of the 4 satisfied. And then hiring, retention, and advancement. We know that this employer has a fair chance hiring policy. It's consistent with federal and the state laws where it has its workplaces. And the employer permits individuals with SUD-related criminal records or debts to compete for job opportunities and to work productively. So they get another 10 points and another one of the categories satisfied with their fair chance hiring program. And then under benefits, reliable health insurance, meaning that the employer verifies at least annually through means that we set forth in the certification document that his health plan appropriately covers SUD treatment. And this is intended really to go to the importance of parity, recognizing that there hasn't been a strong enforcement of parity to this point, and there's a lot more to work still to do. And we believe that the Institute can help advance the reality of parity in the workplace. So another benefit is no-cost assistance, where the employee benefits include access to a recovery-informed service provider like an employee assistance program or a member assistance program for a union that'll provide no-cost assistance to someone who would like assistance for anything related to SUD. So again, 5 points there. And so we're up to 35 points, and that brings us to the last category, education and awareness, and naloxone access. All employees are trained annually on overdose prevention, as well as reversal, and naloxone is readily accessible in the workplaces. And so with this, we see that the 4 categories are established, and we have a total of 40 points. And so this applicant would receive the certification from the Certification Council. Certification Council will be disclosed publicly, and that'll be made up of people with experience in RFW and HR, and they will be the ones to review the applications and make those determinations. A second example of national certification using different criteria, but the same categories. It's the same 4 categories across the board in 2024. Culture, we've got a highly placed ally in the applicant's company. So a senior executive is a visible ally for the recovery community. 5 points under culture. And then under hiring, retention, and advancement, we know that the employer utilizes contingent or return to work agreements, so that if there is an instance of problematic substance use, the candidate or employee is offered either contingent employment or a return to work agreement, so that that person can pursue a therapeutic approach to the substance use while retaining the job and the resources and benefits to be able to get that healthcare, right, to reestablish and maintain wellness. And then flexible work, this is something that is pretty basic. We recognize that, but we want to make it accessible for employers to be able to obtain certification. And a lot of this is about awareness. So the employer provides reasonable accommodations, such as flexible work options, to support employees and their families' health. I mean, largely this means compliance with the ADA and the FMLA, but we want to make sure that that is placed in the context of recovery, and furthermore, that is communicated, which we know from the Forest Marsh survey last year is one of the most important aspects of an RFW, is just communicating that you do have health insurance benefits, that you are required to provide parity of health insurance for medical and surgical conditions, so that they're the same as physical and mental health and substance use are the same as medical and surgical, right? So this isn't one of those examples where we've got the substantive flexible work requirement, combine it with the education, and we can make a significant difference. Benefits, credible medical guidelines are used to place and determine coverage for people with mental health and substance use disorders. This goes again to a recognition that for many people, we know this from patients and family members, when they try to get treatment for SUD, they find that they're being denied access to treatment. And then there are these fake coverage guidelines that are being used to justify the denial. And so we want for there to be transparency, and for there to be the right for people to appeal those decisions and to be able to use the appropriate criteria to appeal those decisions when they're harmful to individuals who need treatment. So you get 10 points if you have credible medical guidelines as part of your health insurance plan. And then education and awareness. This is where we hear that the employer or recovery program leader communicates with employees during orientation and at least twice annually thereafter about the specific RFW topics like parity, like the fact that they have the flexible work arrangements that we discussed in the specific context of SUD. And so with this, we see that the employer has attained 40 points, covered each of the 4 categories, and the Council on Certification would grant that person certification for 2024. The process is intended to be straightforward. It's not intended to be onerous. We intend to be welcoming of as many employers as want to make the efforts and be part of the RFW movement. And so there will be an application and supporting documentation, which would be like a copy of their pledge to support people in the workplace who are in recovery, right? Consistent with the ONDCP and interagency recommendation. The RFW personnel, so the Institute's personnel will verify eligibility, just make sure that we're not wasting the time of the Council on Certification, and then forward the applications for eligible entities to the Council on Certification. And if one doesn't qualify, say the Council on Certification reviews an application and sees that there's a shortcoming, there will be a note that'll go back to the applicant saying that you might consider these things to qualify. And there won't be any sort of restrictive time requirement to wait to reapply or anything like that. Again, we want to flood the market with RFW certified employers and workplaces. And then for recertification after 2024, we do anticipate that there will be an abbreviated recertification process. Frankly, the Institute's been really focused on getting us to this first inaugural class, and we will use the coming months to determine how best to approach recertification. But we know that it must not be onerous and that it must be something that can be done with relative ease and low expense. So the benefits, as I mentioned before, there are the benefits to the employer's bottom line and the culture and all that we discussed about RFW. But for the benefits of certification, we really do intend for the RFW national certification to be an emblem of distinction in the market. And since I've been working on this project, I've been especially aware as I board an airline on Delta Airlines. If you're boarding their airplane, you see on the right-hand side of the entranceway to the airplane, all of the logos that show all the awards that they've gotten or the recognitions and certifications that they've gotten related to their being a great place to work. Our goal is for Delta Airlines to have the RFW emblem of distinction by the time 2025 rolls around. And so it's a lofty goal, but we're confident that we can be included among those types of certifications like the Disability In, like the Equality Index, and the others that we have surveyed and would like to be consistent with and a peer of in the certification field. So we'll have the logo listing on the Institute's website, joint news releases, making sure that there is as great a media outreach as possible. That includes social media and digital marketing support. And then we also will have a report to the President of the United States in Recovery Month in 2024. And so we intend to include the inaugural class in that report to the President this Recovery Month. Got a lot of work to do between now and then, but we're confident that we will have an impressive class to report to the White House comes Recovery Month in September. And then we will also have a certified RFW council that will be distinct from our community of practice, that will be made up of those employers that have the national certification and again want to share their own findings, best practices, overcome challenges, and even provide input on the certification and recertification process to the Institute. So this brings us to the certification next steps. And what we know is that Cathie's set up a list of probably 40 organizations that are this close to being qualified because they're already active and interested in certification. And so she is going to send out an invitation to them that they've been frankly eager for this opportunity and say, look, the doors are opening for applications. Please submit and let's get you certified in time for Recovery Month 2024. And so that invitation will go out, and we're trying to get some big names because we recognize that in the market, no one wants to be left behind. So if anyone has contacts at a large employer that is going to be impressive to other employers to see that, wow, they've gone through this process, please connect them with the Institute. The same goes with any potential funders, of course, for the Institute's activities. We would love to have the benefit of your contacts so that we can grow this movement together. But that especially is the case as we think about other employers, other HR professionals, people wanting to be at the top of their field, the top of their market, and not be left behind. So let's use this as a way to show that the best of the best are doing this, and everyone else should join forces and do so as well. So we'll also announce the Council on Certifications, those people who will be reviewing the applications for RFW certification. And then we'll review those applications mid-July. We're just talking about, we're hoping that we get 40 to 50 applications. We'll be pleased if we're overwhelmed, and we'll figure out a way to review more than that in the event that they come in. So please help us spread the word about this opportunity. Once we know who the Certified Recovery Friendly Workplaces National Certified will be, we will plan media activities with them, plan for a Recovery Month event, plan for the report that'll go to the White House. And then during Recovery Month, we'll announce the class as well as submit that report to the White House. And then I'm going to ask for Cathie to provide her color commentary on this slide. But first, I want to talk briefly about the additional Institute activities because we've got a lot going on. And I know that you're going to be interested in some of these other programs as well. So we want to work to ensure that every state has an organization that is dedicated to RFW. And again, that doesn't necessarily mean state certification if it's deemed that that's not best for that particular state. We want the state to be locally governed for them to determine what is best. But we do know that there should be someone there who's dedicated to promoting recovery-friendly workplaces in the state, supporting those state-specific, state-located employers, and engaging more employers to become recovery-friendly workplaces. And then we also intend to implement an RFW accreditation program, and Cathie will tell you about a collaboration that we have with a continuing education provider to support education for professionals who are going to be supporting the employers as they become recovery friendly. So the service providers really, we will get in that accreditation so that the market can determine who's who and who is following the best practices related to RFW as they choose, who they're going to work with to become recovery friendly and maintain and continue to raise the bar in their workplaces. Then we'll continue to evaluate emerging evidence to improve practices, incorporate those into the certification and other programs, support new research and data collection. Cathie will have another announcement about that, and curate a library that'll complement the already strong federal resource hub of our recovery-friendly workplace resources. And so again, we want to make sure that we are not duplicating efforts, wasting precious funding, or stepping on others' toes. We want to collaborate entirely. This is an example of how we will collaborate to make sure that we're providing supplemental, complementary library resources as part of our own data dissemination. We'll serve as a convener of RFW stakeholders across public and private sectors. We know that we're already doing that in taking over New Hampshire's community practice. We see that our certified Council of Certified Employers will also be another opportunity to engage those, but we'll also do additional types of outreach and education to continue to raise awareness and provide greater opportunities for RFW engagement, and then ensure that RFW efforts, not just at the Institute, but more broadly, where we can have any sort of influence, they promote recovery capital and recognize the diverse recovery pathways. So I'm going to back it up, and Cathie is the Executive Director of the Global Recovery Initiatives Foundation. I'd like for you to share some of the good news that you have to provide. Your microphone's not on.
The great news is that you all are here today, and many more of you than we anticipated. So we're really excited about that. I also want to thank Dr. B for chairing the Board of Global Recovery Initiatives with her vast experience in helping us recruit a board that is going to be key in amplifying this work. Eliza has joined our team. We got a lot of support from Samantha in New Hampshire and the governor's staff, and we're really appreciative of that. And of course, it's really great to have Mike as a partner in all of this on our team, because he keeps me on track and makes sure that I don't come out with some other new outrageous idea that could get us in trouble. So he has really taken so much of the work that we've done and the ideas that we've had and really made them sensible and reasonable and possible. And so all of you have also been hugely helpful to us. I want to start off by saying we skipped over branding the Institute and developing a beautiful, fantastic website. And that's because we took our seed money and we dove in. And one of the things that you all told us was that there was so much popping up in the field, multiple toolkits, different state strategies, lots of things happening, and a huge desire for somebody to get it kind of all organized. So we took that on. Global Recovery took that on to create the Institute, and you all have had a big part of doing that. And one of the things that you said to us very recently was, I know you might want to take a year and a half to develop certification, concentrate, get it done. And so that is what we attempted to show you today, that we're ready to do that so that we can begin to work. The other thing I want to say to you is, we have met a lot of companies who are doing, employers who are doing really good things, universities who are good to their employees, hospitals that are good to their employees, manufacturing companies that are focused on this, white collar, all kinds of companies, all kinds of sizes are out there trying to do the right thing. And so we decided we want our inaugural class to be a class of those people who are already doing parts of this and will be ready to come. So that's why we need your help in identifying companies that are doing wonderful things. So that will be our inaugural class, and we will all come together in Recovery Month and be able to report to the White House on how many employers, and even more important, the number of employees who will benefit from their employer being a recovery-friendly workplace. So bring it on. We're prepared to be overloaded. I also want to talk about the fact that the Institute really would not be where it was and cannot go forward at the speed that we are going without serious partners. And we have already developed a few serious partners, but one who's been with us from day one, which is Forrest Marsh, a research, marketing, communications company that is primarily a government contractor. So they really understand government and public policy and training and all those things. They have been with us with GRI for several years and supported our in many, many ways. And they have been provided in-kind support as we developed this Institute. But what they did that is really extraordinary, which makes the field important, is independently from GRI or the Institute, they made a 5-year commitment to do research on recovery in the workplace. They zeroed in on this as an area that did not have the kind of research that we needed. They have already produced their first report, which many of you have seen on our website or have heard presentations by us for, which interviewed employees, the first survey that ever asked employees, how do you feel about working with a person in recovery or a person seeking recovery? And the results were terrific. And there were also holes that are identified. One of those holes was HR's role in all of this. And so I am thrilled that Forrest Marsh has reached out to HRCI, which is one of the major HR associations in the country. They are going to be a partner with the Institute for Thought Leadership and a partner with Forrest Marsh independently to conduct the next set of research, which will really inform us on where is HR on all of this? What are the challenges they face? What are the things that they think would be helpful in the field to make them for them to execute their programs more effectively? So this is where we want to go from here. We are talking with multiple associations that I can't announce yet, because we want to because Mike thinks we should actually get written commitments from everyone, and we should be very focused on that, which I'm trying to remind myself of. But we have great partnerships in the mix that are associations, business associations across the construction trades, unions, manufacturers, and all of this will help us amplify this. We have a company that will serve on our corporate council, Shaw Industries, and one of the co-chairs will be Nikki Sharp, who is the head of health and wellness at that company. And she said to me, we should get our vendors to become recovery-friendly workplace. That should be part of our contracts with vendors. So we are experiencing wonderful things, finding these partners who want to amplify this work. Think of what happens if the U.S. Chamber, think of what happens if the National Drug and Alcohol Screening Association are all getting their members to become recovery-friendly workplaces. It will grow a movement like we've never seen in the Institute. Finally, I just want to say that GRI is committed always to looking for spaces where others have not gone, where there's a gap. Usually it involves a place where there isn't funding. So we are always scrappy about how we try to address those things and figure out where to get the funding to really amplify them. But one of the things this institute will do, which is consistent with GRI's principles, are that we will convene people from all sectors. We will be a thought leader in this institute. We will challenge the things that need to be challenged about how benefits are administered. Where is the money coming from? Where does it go? How our insurance industry truly providing the equity for SUD that they provide for any other condition. We will challenge public policy. We will convene the leaders of federal agencies and say, how are we going to make the federal workplace a recovery-friendly workplace? We will work with governors, and we're so pleased to have the National Governors Association involved because honestly, governors connect with business on a daily basis. It is part of the economy, a key part of their economy of their state. And so governors taking the lead in this are really exciting to us, and we're looking forward to that. So there will be lots more to come. I am thrilled that you all came. I know you have a gazillion questions, and I know that we will get to them. We will be putting on probably monthly webinars going forward to tackle different issues. For example, ONDCP will have a conversation with us next month where they will talk about how do you get certification by working around a drug-free workplace? What are the ways that you can become a recovery-friendly workplace, even if there are federal laws or state laws that are making it difficult for you to do all the things that you want to do? And they're openly going to discuss ways that they think people can work around that. We'll also have some future presentations, and we hope a big one when we go to Washington in Recovery Month, where we will highlight employers. Some will be nonprofit, some will be for-profit, some will be small, some will be large. Interesting programs that they have created in their companies. Things like Salesforce having a sober force of employees who've become peer counselors. We'll have discussions about the challenges of laws in every state being differently about what a certified recovery coach is. How are EAPs? How are we working with mental health? How are we working with all the other entities? The Institute will be a convener to bring the thought leaders together to sometimes debate, to sometimes respectfully disagree, and to all figure out how we finally break through the final walls of stigma that say a person seeking recovery, a person in recovery is as valuable and as important to our culture, to our society, to our our place of work, whether that is a nonprofit, a mom and pop shop, a company in the Midwest, a company on the coast, wherever they are. And guess what? We get to do all of this in our lifetime. So I am really excited for what we have gotten accomplished in a few months. We are seeking funding, so we are going to be talking primarily to the private sector. We will do some government contracts if it's appropriate, but we really want the private sector to fund this part of the recovery movement. It is now time for the 14 million people who are currently working in full-time jobs in this country, and the 26 million people who have substance use disorder, a huge portion of them struggling, coming to work every day, figuring out how to get through the day, sometimes white knuckling it, and they shouldn't have to do that. And so their employer will become a place that will say, we're here to help. So I would just say, Dr. B, I don't know if you have anything you want to say in closing, but thank you all for being here. And this, there will be many more opportunities for us to talk and work together.
Well, I'm overwhelmed by the amount of information that the two of you were able to share about this process in less time than we had planned for it. And Mike will tell you, I'm always grateful when we can claim a few minutes to ourselves from the work that we do. So I'm not going to belabor this and make it hard for anybody. I just want to express a tremendous, deep gratitude to Eliza for making sure that everybody was able to get here today, and always making sure that there's not a single person out there who's trying to get information about this project who has difficulty getting it. She's always there in the spirit of another organization. She's always available when someone calls for help. And, you know, we are trying to have those principles reflected in the work that we do. It's reflected in the lives that we live. Cathie, your ability to reach out for people and to inspire them to be motivated to do something, whether it's donating $1 or donating something even more precious, our time, it makes you the perfect partner for me in trying to create chaos, order out of this chaos that we were delivered with. And Mike, your ability to bring structure and support to all of our projects that we've all engaged in over many years since you were first introduced to these concepts in your work at ONDCP, and turned your legal career from other work that had been very meaningful to you to making this your life's work. We're grateful to have you as a partner. Of course, Chuck is still here with us. He had to switch to a phone because his family is dedicating a building in the name of his mother, and he had to switch to the phone so that he could participate in that and this too. But it just goes to show you how we all multitask. But I want to give everybody 5-6 minutes back so they can take a bio break before their next Zoom requires that they sign on time. And I want to thank you for being here, and we look forward to seeing you at a White House sponsored recovery event around this very topic. We appreciate your being willing to be the first to embark on this and to get the certification with us and to continue to refine our work. So thank you for attending. Thank you for what you do, and we look forward to working with you very soon.
Thank you, Dr. Barthwell. And a final reminder, if you have questions, please email them to info@rfwinst.org, and we will send you the certification document, these slides, as well as the answers to any questions that anyone may have about our certification program. So once again, thank you all, and we look forward to working with you very closely as we continue the Institute's activities.
Remember, it's an open book exam, and we want all of you to pass.
That's the
So we'll
best.
see you soon.
Thank you, everybody.